Hi, my name is Marie Jablonski, and I am a nursing student and a nursing assistant at a local hospital. And at this hospital, I've seen a policy in place where patients have PICC lines and they flush them with heparin. A PICC line is a peripherally inserted central catheter, which means it's like an IV, but it's inserted internally towards the heart so that patients can receive regular medications. It's not as traumatic to the body. So heparin helps to keep this line open so that it doesn't clot at the end of the IV line. Usually patients that have PICC lines are cancer patients, intensive care unit patients, patients that receive medication on a regular basis. The policy has been proved to in other hospitals, and there's other cases where they've proved that heparin is not good for the patients. In 2008, in February of 2008, the U.S. Food and Drug Administration recommended that they stop using heparin, multi-dose and single-use vials, because of oral swelling, nausea, vomiting, sweating, shortness of breath, and severe hypotension. Also, patients can develop heparin-induced thrombocytopenia, which means they don't form platelets anymore, or they don't form enough platelets to form clots, so they can have severe bleeding issues. This is a great concern for patients, so to change this policy would greatly benefit patients. Also, it would reduce the cost for patients too with the saline solution flush instead of the heparin. Saline has no adverse effects for the patients, a naturally occurring substance in the body, so patients can't be allergic to it or have a bad reaction to it. Typically, it would be like a 10 milliliter flush before you give a medication, and then a 20 milliliter flush after you give a medication. To implement this policy, you would first need to form a committee comprised of nurses, physicians, people in the administrative branch of the hospital, and research findings and make recommendations on how to implement this policy and write it. Then after this is done, then you would go and present it to the lawyers, and lawyers would review and implement the policy, present it to the administration and to the hospital, and then they could make it into a formal policy. The implementation of the policy would be to first present it to the managerial staff and have them educated on the new policy. They could review it and be prepared to present it to their staff. And then, of course, then the staff would need to be informed, the nurses and the people that would be involved in actually administering the therapy, the pharmacists, the physicians, would need to be educated on it and then informed on that. And then after that, of course, you would implement it and put it into practice. I would also recommend about a year later or on a yearly basis to review the policy and do any changes that would need to be done. Any suggestions could be taken at that time on a yearly basis, and then also updated if it were needed. Thank you.